Hey everyone, my name is Jessica Bash and I am going to be assessing cranial nerve 5, otherwise known as the trigeminal nerve. The trigeminal nerve is the largest of the 12 cranial nerves and it has many functions. These functions include innervating muscles of mastication and controlling sensation to the face. Some other functions that this nerve includes is flattening and tensing of the soft palate. It aids in the movement of the larynx, it aids in the opening and closing of the jaw, and the opening of the eustachian tube. The trigeminal nerve transmits both sensory and motor information, which means it has both sensory and motor functions. In regards to the sensory components of the trigeminal nerve, it is responsible for relaying sensation from the face to the brain, as well as relaying pain, touch, and temperature. In regards to the motor components of the trigeminal nerve, it is responsible for range of motion in the face as well as movement such as chewing, biting, and other movements of the face and mouth. The trigeminal nerve has 3 divisions, all of which are tested and have slightly different functions. The first division to be discussed is the ophthalmic division. The ophthalmic division is responsible for carrying sensory information from the scalp, the forehead, upper parts of the sinuses, the upper eyelid, and associated mucous membranes, as well as the cornea of the eye and the bridge of the nose. You can consider the ophthalmic division in the forehead region. It also contains sympathetic nerve fibers that are responsible for pupil dilation, and it also supplies the ciliary body, the iris, lacrimal glands, the conjunctiva, and the cornea. The ophthalmic nerve also supplies the superior portion of the nasal cavity, the frontal sinus, and some deep structures such as dura mater and the anterior cranial fossa. The second division to be discussed is the maxillary division. This division is responsible for transmitting sensory information from the lower eyelids and associated mucous membranes to the middle parts of the sinuses and the nasal cavity, as well as the middle parts of the nose, the cheeks, the upper lip, teeth of the upper jaw and associated mucous membranes, as well as the roof of the mouth. The third division to be discussed is the mandibular division. This division is the only one with both sensory and motor functions. It stimulates movement of the muscles in the jaw and some of the muscles within the inner ear. It communicates sensory information from the outer part of the ear, as well as the lower part of the mouth and associated mucous membranes, the frontal and middle parts of the tongue, the teeth of the lower jaw and associated mucous membranes, as well as the lower lip and the chin. I am now going to begin the assessment of cranial nerve 5, the trigeminal nerve. The first component I am going to address is sensation. I'm going to start by having you close your eyes, and I'm going to apply pressure bilaterally with a cotton swab, and I'm going to apply it to the ophthalmic, mandibular, and maxillary regions. And you're going to tell me when you feel it by saying yes. Cool?
Mm-hmm. Yes. 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 Yes.
Great. Next, I am going to use a sharp item to do the same thing. I'm going to apply pressure bilaterally on the ophthalmic, mandibular, and maxillary divisions, and you're going to tell me when you feel it by saying yes. Close your eyes.
Yes. 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 Yes.
Great. Now I'm going to interchange the cotton swab and the sharp item. And I'm going to apply pressure bilaterally, and you're going to tell me when you feel the sharp item or the cotton swab.
Okay.
And you're going to say soft or sharp.
Okay.
Ready?
Mm-hmm. Soft. Soft. Sharp. 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 Soft. Soft. Sharp. Soft. Sharp.
If the patient has a diminished reaction or does not report feeling after conducting this part of the assessment, this could mean abnormalities in the trigeminal nerve. The next test will assess corneal reflex. I'm going to use a cotton swab while you look straight ahead, and I'm going to tap the side of your eye to see if you respond by blinking. Ready? After conducting this assessment, if the patient does not blink bilaterally or respond in any way, this could indicate abnormalities in the trigeminal nerve. Finally, I will be assessing the motor function of the mandibular region to test range of motion and strength. First, I will be looking at the patient as they open their mouth to see if there are any abnormal deviations in either side of the face. So, open your mouth. Looks good. I will then ask the patient to push down against my hand with their mouth by opening their mouth to test resistance and jaw strength. So, great. Now, I want you to move your mouth from left to right while open. Wider. Great. Abnormalities are noticeably present if the patient is unable to move their jaw with the resistance of my hand, which would indicate that there is a problem with the cranial nerve 5 or the trigeminal nerve. My patient tested well in the sensory component and the motor component of the exam. The trigeminal nerve is highly significant to professionals such as speech-language pathologists because cranial nerve 5 innervates the muscles that control speech, and damage to this nerve can result in difficulties with chewing, swallowing, articulation, and phonation. Cranial nerve 5 is essential for creating and maintaining speech sounds, which is essential for speech-language pathologists. Damage to this nerve can be ipsilateral, unilateral, or complete paralysis. Sensitivity to sounds may increase if there is paralysis to the tensor tympani muscle. Damage to this nerve can also result in pain in certain portions of the face, as well as losing feeling in certain portions of the face. It is highly important for an SLP to be able to conduct a cranial nerve exam to test for deficits and abnormalities when it comes to mastication, swallowing, articulation, and phonation as related to damage to the trigeminal nerve. Thank you so much for listening.